Assalamualaikum and hi everyone. We are from Group 4, which consists of me, Ivy, Nur Iziani, Nur Suana and Siti Alia. We'll be presenting on the case study of panic disorder. For this presentation, I will be presenting the introduction, Suana will be presenting on the psychoanalytic therapy, followed by cognitive behavioral therapy by Iziani, and the humanistic therapy by Alia. And lastly, the conclusion is by me. Now, if you're ready, let's start! Panic disorder can be determined by at least 1 month of continuous terror of panic attacks or their effects reappearing.
Now, let's take a look on the case study of Miss A, a Jewish graduate student who is diagnosed with panic disorder. Miss A has extreme anxiety and emotional turbulence. She is in a violent relationship with her boyfriend and has many relationship problems with the people around her. Both her parents have mental disorders. Her past psychiatric history detailed that she encountered frequent panic attacks with tachycardia, prominent tachypnea, loss of balance, and irrational beliefs that she was losing her mind. All of this began in her 2nd grade of school. Miss A's social history suggested that she excelled well in her education, but she always felt that she was not good enough and that her sister was always superior than her. Miss A's panic disorder was not accompanied by agoraphobia. Miss A had no past history of other mental disorders, and her medical history was found unrelated to her panic disorder.
Moving on, we will be describing the different kind of psychotherapies conducted in relation to this case study. Over to you, Suana.
Thank you, Amy. Hi everyone, I'm Suana. So, today I will focus on psychoanalytic theory. Psychoanalytic theory was pioneered by Sigmund Freud. Actually, this theory was based on the primary assumptions of psychoanalysis, in which the belief that all possess unconscious thoughts, feelings, desires, and memories. However, in order to help the client, which is Mrs. A, I will focus on panic-focused psychodynamic psychotherapy, which developed based on this psychoanalytic theory. For this therapy, Mrs. A will go through with the 3 phases of therapy. In the first phase, the therapist will explore the threats that might make Mrs. A have panic disorder. Then, for the second phase, the therapist will make a further exploration on her panic attacks, and the last phase, the therapist will help Mrs. A terminate the thoughts that are unconscious to be more conscious. As a professional therapist, in order to make sure our clients be more cooperate with us, so we must make sure that we have a good skill to manage them properly. It means we cannot force them to trust us, especially when the client had a trust issue such as Mrs. A's situation. However, we must calmly convince them until they are totally comfortable with us. So, for the benefit, Mrs. A actually become more confident in herself because the therapist helped her to terminate the bad things that happened to her before this. It makes all her unconscious mind, such as anger, become more conscious and try to make it as experience as well as build a strong relationship. I think that's all from me. Now I will pass this presentation to Iziani. Thank you.
Thank you, Suana. Hi everyone, I am Iziani. So today, I'm going to present on cognitive behavioral therapy, also known as CBT therapy. CBT therapy can be described as a form of psychological treatment that has been demonstrated to be effective for a range of problems, including depression, anxiety disorders, alcohol and drug use problems, marital problems, eating disorders, and many other severe psychological disorders. So, for our case study that's centered on Miss A, that's been diagnosed with panic disorder, she has received both exposure and graduate therapy for CBT treatment. In exposure therapy, Miss A has been exposed to a situation, event, and object that triggers anxiety, fear, and panic. As for relationship therapy, the therapist has told Miss A to do the home practice exercise that was required for her to do it 2 times a day. According to Kirsten and Steven in one of their studies, the therapist must be knowledgeable of the observations and interviews and openly resolve disputes between the research aims and client expectation in the therapy that is undertaken with the specific client. From Miss A's perspective herself, she could describe that this time, the therapist is one of the reliable and trustful people that she ever met. For the first few sessions, Miss A seems distant and hesitant with the therapist as she feels distrust and feels suspicious about the therapist. As a professional therapist, she has ethically conducted the session by asking a few questions, depends on Miss A's comfortableness throughout the session. As for the benefits that Miss A has received through this CBT therapy, it helps her to develop her low self-esteem. Through this therapy, it can help her to have more confidence in her own abilities. Another benefit that Miss A has obtained is that it allows her to concentrate on retraining her beliefs and changing her behavior patterns in order to modify how she feels in her daily life. I think that's all from me, and I'll pass to the next presenter, Alia.
Thank you, Iziani. Assalamualaikum and hi everyone. I'm Alia that will present for humanistic therapy, which I am focusing on person-centered therapy or known as client-centered therapy or virtual therapy. PCT developed by Carl Rogers in 1940s to treat clients with depression, anxiety, panic disorder, and relationship issues. One major difference between humanistic therapies and other therapies is that they refer to those in therapy as a client, not the patients. This is because they see the therapist and client as equal partners rather than as an expert treating a patient. So by referring to the case study, Miss A have a problem mainly in panic disorder, alongside with anxiety, trauma, and relationship issues with her family and her fiance. Throughout this session, Miss A as a client is allowed to share her feelings and thoughts with a free will. As a therapist, they believe that the client is the expert one who knows their past experience and problems as well as her own acceptable solutions. This session actually encouraged Miss A to think and decide what kind of solution is the best for her rather than depending on the advice of the therapist, and helps them to discover about themselves and develop self-acceptance in which they accept who they are and all of their past experience. All of this led Miss A to be more confident when it comes to the decision making and problem solving skills, which can assist her to have a better life after the session. And I think that's all from me. I will pass to Ivy.
In conclusion, we believe that the best psychotherapy for Miss A would be the cognitive behavioral therapy. This is because cognitive behavioral therapy will address the present symptoms by changing Miss A's irrational thoughts and behaviors. Furthermore, as compared to the psychodynamic therapy, cognitive behavioral therapy requires lesser time with only about 6 to 12 sessions. Next, cognitive behavioral therapy will be more in favor as compared to the humanistic therapy because it is directive in nature and has a specific goal treatment. All in all, we are convinced that cognitive behavioral therapy will be a good choice for Miss A's therapist, but if it does not work out, it is completely fine for the therapist to go for other psychotherapists for Miss A. That is all from us for this presentation. Thank you for listening. Bye-bye.